Welcome to My Dental Key's radiology video on Bitewing radiographs. This video is part of My Dental Key's series on capturing intraoral radiographs. Bitewing radiographs capture the crowns and horizontal bone levels of the maxillary and mandibular teeth. They are primarily focused on the premolars and molars on the right and left sides of the mouth. Bitewings are especially important for interproximal caries detection, as interproximal caries are often undetectable when performing a clinical exam. In addition, bitewings are helpful for assessing bone levels and evaluating periodontal health. In adult patients, 4 bitewings are conventionally taken per patient, 2 on the right and 2 on the left. On each side, both a premolar and a molar bitewing are made. In pediatric patients, the number of bitewings depends on which teeth are present. Typically, 1 bitewing is obtained on each side in the primary and mixed dentition. Bitewings can be made either in a horizontal or vertical orientation. Horizontal bitewings, taken in landscape orientation, capture crowns of teeth and a small portion of alveolar bone, making them ideal for detecting interproximal caries. Vertical bitewings, taken in portrait orientation, capture more of the alveolar bone height, and are therefore especially useful for assessing periodontal bone levels. Now we will discuss the procedure for capturing bitewings. Assemble the armamentarium as shown in this illustration. If shielding, place the lead apron with the thyroid collar securely around the patient. Of note, new recommendations from JADA show that abdominal and thyroid shielding are no longer recommended due to minimal radiation risk. Adjust the dental chair to place your patient in a comfortable, upright position. In this video, we start with the RIN assembled. Please refer to My Dental Key's RIN assembly modules for additional information. Explain the steps of capturing an X-ray to the patient. For example, show the patient the bite block and review the RIN and X-ray machine with the patient. Request that the patient remove any removable prosthodontic or orthodontic appliances as applicable, as well as any intraoral jewelry. Now, ask the patient to open and gently place the bite block onto the teeth and position the sensor adjacent to the teeth that you want to image. For the premolar bitewing, the bite block is placed to align with the premolar region, ensuring the distal of the canine to the mesial of the first molar are included. The molar bitewing is obtained more posteriorly, so that the molars are the focus of the image, ensuring the distal of the second premolar to the mesial of the third molar. Instruct the patient to bite their teeth together on the bite block and remain still. Tip: if a partially edentulous patient does not have a metal-free prosthesis that can be used to aid in capturing the bitewing, a roll of cotton can be placed across the edentulous span to aid in stabilizing the bite block. With the sensor in place, slide the ring down the aiming arm closer to the skin surface. When using the paralleling technique, the X-ray receptor or sensor is placed parallel to the long axis of the tooth being imaged, aligning the X-ray beam perpendicular to both the receptor and the tooth. Proper alignment of the X-ray head parallel to the sensor is important. Ensure that this is perpendicular to the penetration through the desired contact areas. If the orientation is not correct, the radiograph will have overlapping contact areas, making the radiograph not diagnostic. Step out of the radiation zone. While visualizing the patient to ensure they haven't altered their position, press the exposure button to capture their image. After capturing the image, inform the patient that they can slightly open their mouth. Tip: some patients have difficulty closing and staying closed for bitewings. Prepare them by instructing them to open immediately after they hear the sound of the exposure. Remove the sensor and RIN assembly from the patient's mouth. Repeat the steps for the molar bitewing using the more posterior positioning of the sensor. Repeat the molar and premolar bitewings on the contralateral side of the mouth. Assess clarity and accuracy of the image. Evaluation can be completed after each exposure when using a digital sensor or after processing if processing is required. Specifically, for the premolar bitewing, The goal is to capture the distal half of the canine, the first and second premolars, and the mesial half of the first molar. Ensure all contacts are clearly visible, in other words, not overlapping. For a molar bitewing, the goal is to include the distal half of the second premolar, the first and second molars, and the third molar, if erupted. All contacts should be visible without overlap. Note: following ALARA as low as reasonably achievable principles, if a contact is overlapped in the premolar bitewing but open and visible in the molar bitewing, there is no need to retake the radiograph for this contact area. In summary, for bitewings, ensure you have performed number 1, appropriate patient management, and number 2, ALARA. Diagnostic images should have the following features: complete complement of the bitewing radiographs. Premolars and molars are visualized. Open interproximal contacts with little to no overlap between teeth. Visible alveolar bone levels in both the maxilla and mandible. Sharp imaging with clear contrast. Free of distortions and artifacts. Recapture any images that do not meet these criteria. Thanks for learning with us.